Hi everybody, welcome back. If you're new, welcome. I'm Irene and this is Lifestyle Over 60, and today I'm talking about plastic surgery. I'm going to come clean about what I've done so far and talk to you about what I have learned about what to look for in a plastic surgeon and what kind of procedures to think about if you're thinking about having anything done at all. Coming up. Sometimes I like to watch the plastic surgeons on here who will show you a celebrity like Jennifer Lopez, let's just say, early in her life, and then as she goes throughout her career, this plastic surgeon will talk about what procedures he or she thinks they've had done. It's kind of fun to watch. I don't know, I like this particular doctor. And so I like to watch him and see the celebrities, what they have done. And when you do that for a little while, your eyes kind of get used to seeing the surgery and you're like, wow, a lot of celebrities have had multiple facelifts by the time they're in their 60s. But, by the time they're in their early 40s even, I would say a whole lot of celebrities have already had at least one facelift already. Okay, so what have I done? Well, in my early 20s, I was an actress. I mean, going up from there too, but in the story, I'm in my early 20s, I'm an actress, and I had an agent and I was trying to get work. And I had more than one agent, casting director, I think, acting coach even, tell me that if I wanted to work, I had to, fix my nose. Yeah. So I believed them, and what I did was I found the best plastic surgeon I could find, and then I interviewed someone who had had their nose done by him. Actually went to her apartment. She was so lovely, and looked at her nose and talked to her about her surgery and was she happy, and she had the perfect nose, and I was like, okay, that helped too. So I chose a really good surgeon, and then just sort of cleared the decks and had my nose done. And so I was 24 at the time, and that's within 6 months I got my first part on General Hospital, and I pretty much worked after that. So it was something that did hold me back from working, even though it's not fair, it shouldn't have, all of those things, right? But it did. And so I'm not sorry that I changed my nose, and I've had this nose longer than I had my old nose, So here's a photo of me with my old nose. It was just kind of wider and larger on my face. And, you see me now. So I'm not sorry I had it done. I'm not at all. Okay, and you can probably tell from, the video so far that it's not the only thing I've done, and it's not. I've done one other thing, and that was done when I was 44, so 22 years ago. I had kind of under eye bags pretty bad that were just genetic. I just had them, and people would say I looked tired all the time when I wasn't. And no matter how much sleep or makeup or whatever, just, these bags were there that I didn't like. So yeah, when I was 44, I had surgery to have them removed, and I'm not sorry. So I think that surgery is called a lower blepharoplasty. And, it's basically a skin surgery, so it wasn't a lot of recovery afterwards. I just remember putting frozen peas on my face for a while, and just some swelling and bruising, but not bad. And the results have been really good. Although one eye is better than the other, I'm like, whatever. But I'm happy with the results. So what I have learned, I like to use Facebook as kind of a focus group, as some of you already know. And I asked my 5,000+ Facebook people if they've had plastic surgery, and if so, if they're happy with it. And the few that were brave enough to say yes, they have, were all happy with it, all of them. And I think that's like a thing. I think that most people who have had something done are happy with the results. So what do you want to do when you're like considering getting something done? And what I've learned, I've done a lot of research. One of the things that you really need is a board certified plastic surgeon. Now, I'm in America, so we have board certification. I don't know what you have where you live if you're in a different country, but you want to find the best surgeon that you can. And here we have something called cosmetic surgeons. A dermatologist can call themselves a cosmetic surgeon. You don't want that. You want to go to a board certified plastic surgeon who has trained specifically in what you're having done. Because, when it comes to a facelift, it's your face, it's kind of important. So you want the best surgeon you can find. And then the other thing is to think about that, a facelift does not include everything. You would think it would, right? Oh, you just go and everything's lifted and they're done, but it's not. Facelift is, I believe, it's just this part, okay? So it doesn't include the brow, it doesn't include the eyes, it doesn't include the neck. I don't even know if it includes the jaw. So if you want to have like a facelift, probably what you really want is like the whole thing done at one time. And the research I've done, and do your own for sure before you do anything, tells me that it's better to have it all done at once than to do things piecemeal, because it's going to look more natural and last longer if you do it that way all at once than if you piecemeal things. Some of what you see in celebrities, like let's just say Madonna, Demi Moore, and on the younger side, people like Bella Hadid did it, and this Emily, I cannot say her last name, did it. They're having the buccal fat, which is the fat right under the cheeks, removed. And in an older woman, older person, it just, in my opinion, it does not look good. It's supposed to make you look more model-esque, more skeletal. Yeah, but when you see Jimmy or Madonna with it, wow, I just, personally, I don't think it looks very good. And as we get older, we tend to want to like inject fat back into the face. We lose volume. So I don't know about this procedure. Anyway, as an older person, I would not recommend it. Ideally, I think it would be great if we could just accept aging, if we could just age gracefully and have wrinkles and have gray hair and have crepey skin without feeling like we have to crepe erase and that we have to cover up, or that we have to freeze our faces or fill them or suck fat out of them, in order to be socially acceptable. It's sad, really. And it's my hope that as women rise up and as we get more powerful in American society, but hopefully in global standing, that our value won't just be on our youth and our beauty, but that we will be valued for who we are and what we do, just like men are. And until that happens, if you're considering plastic surgery, don't be ashamed of it, I don't think there's anything wrong with wanting to look as good as you can for as long as you can. I'm personally really afraid to have any kind of surgery. As a lot of you know, thank you, by the way, for the kind words. I just got out of the hospital after being hospitalized for a week for an infection. So if you missed that, I'll link that video below. Yeah, that was really no fun. But, most of these kinds of plastic surgeries are done in a surgery center, so you shouldn't need to go to a hospital. But it is still surgery, and recovery does take time. You know, one of the plastic surgeons that I watched said that for the full plain facelift, you know, that involves the muscles, that recovery can take like a year, you know? So it's not just a little skin surgery when you have a full-on facelift. It does involve the muscles and a lot more risk. There's a risk of nerve damage. There's a risk of death from the anesthesia. There's a risk that you won't like it. You know, there are risks. But overall, people seem happy with what they've had done. So whether or not you should do something is between you and your ability to afford it, and probably the culture around you. You know, like if a lot of people around you have had surgery or have it or having it, you're going to be pressured to as well. If you live in the Midwest and no one does it, then, you know, forget it, right? Or if you live in a country where it's just not a thing, then great. Then don't do it, right? And I think if it's not a thing, why would we put ourselves through that, you know? Really. So, anyway, my message with this video is if we could just accept our aging, that would be number one, plan A. Otherwise, plan B, if you're going to have plastic surgery, do your research, find the best surgeon, interview some of their patients in person, see the work in person, and make a really informed choice before you do anything. And that's it. And so hopefully you got something from this video, and so if so, like, subscribe, and come back and see me again really soon.